Still the same. Yeah, now same.
Right.
Now
Okay. Good luck.
I'll start. Thank you very much. Okay, so we are going to learn about death investigation system, MLEF and the MLR. So in death investigation system, you have to know some basic things to get the answers right in your MCQs. So one thing is why you are going to do a death investigation. What is the structure behind that, and why country use a death investigation system. So one thing is for uh, criminal and civil judicial purposes. Like in criminal sense, like you can take a homicide, and also civil judicial purposes, like something happens to a influential person that can influence the society. So to prevent other similar deaths means so in some kind of deaths like maternal deaths and deaths due to animal attacks, that kind of deaths we can prevent by having a good death investigation system. And to support in grieving family and friends, sometimes finding the cause of death can help. And then there are two systems which use in different part of the world, and we use the coroner system as we are a country which were under British colonial rule. So the British people came up with the idea of coroner system. In coroner system, coroner is somebody with a law background, like a lawyer. So in Sri Lankan setting also, uh, inquiry into sudden death, we use that term, and it's mostly a lawyer. Uh, as the medical examination system is completely opposite. It's used in the USA, and it is done by the JMO or forensic pathologist in USA. So we have to know and know something about criminal procedure code's idea about the death investigation system. Criminal procedure code is the Dandaniti Sangrahaya in uh, Sri Lankan setting, and um, so in that there are some things related to death investigation system, like all citizens should inform any kind of unnatural, violent, or suspicious, so any unknown kind of deaths to police officer or Grama Nildari as soon as possible. So if the person can directly inform magistrate and inquirer, it's also okay. But usually in Sri Lankan setting, we inform police officers of or Gram Nildari first, and then to the magistrate. That is the process. So then what is the inquest? We have to know what is the inquest. Inquest is like an investigation to find the apparent cause of death. It's not the cause of death. There is a difference. Apparent cause of death, it is decided by all the circumstances and other things as well, not doing a proper post-mortem. So it will be conducted in public setting, and the inquirer or there are two types of inquirer. Inquirer into sudden death or the magistrate have the power to do the inquest in the public setting, and they can collect the evidence, and also uh, they can um they can ask the people for the evidence. If they reject, they can issue a warrant. Uh, even that also happening. And this kind of inquest is happening for suicides, animal, machinery, accidents, sudden deaths, and unknown causes of deaths happens. And it is evaluated by magistrate and the ISD. But there are certain deaths only magistrate have power to do an inquest on. So one thing is death by violence or accidents, and any kind of suspicious death, and also death in custody, death in prisoners, death in mental and leprosy hospitals. So what is the importance of death in custody, death in prisoners, and death in mental or leprosy hospitals? The important is these patients or these persons will be kept at uh, kept not at their will. That means they are kept against their will. So that is some huge deal there rather than investigating other people. So like death in custody means death in the prison or the remand, death in remand basically, death in prisoners and death in mental hospitals are important because of that. You will only done in inquest by a magistrate. And also if the inquest comes as inconclusive, we have to do a post-mortem. It is a judicial post-mortem. What is a judicial post-mortem? So judicial post-mortem is a procedure done if the inquest fails. So it is different from the pathological post-mortem. So what are the key differences? One thing is in judicial post-mortem, it is done by the JMO. And also, it is do a judicial postmortem. Cause of death should be unknown, and also you don't have to take the uh, relatives' consent to do the judicial postmortem. And there are some instances we have to do mandatory postmortems also. No consent needed for doing a mandatory postmortems. It's like in maternal deaths, accidents, suicides, firearm injuries, and when the cause of death is unknown. So pathological postmortem is completely different kind of postmortem. It is usually done for the sake of the science, which usually done in the hospital, and it is done when the cause of death is known. In the judiciary postmortem, it's other way around. Like the cause of death is unknown. So in pathological postmortem, we have to take the consent from the relatives or the head of the department. In a maternal death, we have to take the consent from the head of the department as well, and it is usually done by the pathologist, not by the JMO most of the times. So then we have to discuss about the death registration. So death registration is done by Birth and Death Registration Act, and yeah, in the death certificate you have to fill the J form. So J form is filled by the last doctor who have treated, and also we have to know the uh, person who goes to the death registrar to do the get the death certificate. So that person is named declarant. And in a hospital setting, when you are the HO of the ward, you can act both as the last doctor who have treated. That means you have to fill the J form as well as the declarant as well. So. Uh, so there is a good summary about the death investigation system in Sri Lanka, which can you can use to answer your MCQs. So in any kind of deaths which is at home or at hospital, which is causes natural or known, you can go in the normal pathway. In home deaths, usually death certified by the MO, like last treated doctor, and then fills death declaration form and hand over to the relatives. And then the relatives can goes to the Gram Nilidhari, and after that they can directly go to the registrar in birth and deaths. If the death happens in the board, it is slightly different. Then, if the cause of death is known, declarant as the MO, the house officer is the declarant, as I said before, he can get the death certificate by uh, submitting that to the birth and death registrar. And after that, they issue temporary death certificate, and after some time, after a few weeks or months, now it's not 3 to 4 months, now it's somewhat earlier, but you have to wait some time to have the original death certificate. Until then, uh, uh, you have the temporary death certificate to use. And also, when the cause of death is unknown or unnatural, inquest is ordered, and from the inquest, our main target is to come for a apparent cause of death. So, if the apparent cause of death is unable to give, we have to go for the judicial postmortem, and with judicial postmortem, we comes with the cause of death. That is the summary of death investigation system. So then we have to learn something about medical legal examination form and medical legal report. So medical legal examination form is a document which was issued by the police, and there is a two parts called A part and B part. A part is completed by the police officer and the B part is completed by the doctor. However, the police copy, there are two copies, and however, the police copy and the doctor's copy both should be filled by the doctor. Basically, B part is filled by the doctor. So in MCQ, if it's asked that like doctor only have to fill the doctor's copy, it's wrong. Doctor have to fill the both. And also, uh, this is police officer has to fill some areas like police area, date of the issue, name and address of the victim, and what should the doctor fill is the broad topic, and I would teach it quite late in this presentation. And medical legal report is a different document. It is the document that we submit to the courts. So it has extensive description of injuries and category of hurt. It's really important. So, so in that we have to write everything about patient's history, patient's injuries, category of hurt, and also the uh, investigations, all the imaging done, and also the surgeries and the other treatments he has to undergo in the hospital stay. Then this is a MLEF. This is the medical officer's note. So, in medical officer's note, there is a slight difference with the police officer's note. I can show it later. So, in medical officer's note, you have to write these things. These things are not important in the exam setting mostly, but it is important to practice as a doctor, as a house officer in Sri Lanka. So, so these are the important things. This is the part A. Part A is filled by the police, and then there is part B. It is filled by the doctor. So there is date of admission, date of discharge, BHT number, and the pattern of the injury, like whether there are abrasions, contusions, lacerations, cut or stab injuries. That will be marked in there. And the thing is, you have to put your signature if the injuries are there, not any cross mark or any other mark. You have to put the signature. And there are other parts like nature of the weapon, like whether it's a blunt weapon or sharp weapon. So we can learn those things in our 18-week course. Um, about the injury patterns, and also then there is category of hurt. There are some groups like non-grievous injury, grievous injury, and also the fatal in the ordinary course of nature injury. So those things are important. And also there are some details about the investigations, whether there are any referrals, those things as well. And in the doctor's copy of the MLEF has this kind of a drawing diagram from the patient's front and the behind. And you have to mark the injuries in the relevant part, and also you have to uh, write the injury. You have to number the injury and write the details about the all injuries. And yes, this is it. And this is the police report. Police report is slightly different, but the B part is filled by the doctor. It's same. So this is somewhat different. Medical legal report. Medical legal report is a really important document, which is filled by the doctor, and these are the documents submitted to the courts. And also, even the doctor gets transferred, a doctor have to keep a copy with him. Uh, if there are any need comes along his career, like even if he's transferred in a 10 years of time, he can be questioned in the court uh, about this problem, like if there is assault or any kind of thing, you have to give the evidence in the court. You also, if you are summoned to the courts, you have to submit this document, and you have to remember everything uh, about the injury. So better to keep a copy of the MLR. So in MLR, these are the important things. So one thing is serial number, medical legal form, magistrate court, date of issue, court number, police summons, and date of the trial. And also in first part the there are the place of the examination, date of the examination, and time of the examination. Other than that, name, age, address, and gender, those are the important things. And also the date of admission, date of discharge also important. And also we have to, in the B part, we have to write about a short history that is given by the patient in his exact own words, like the injuries and the defense mechanisms, and the who tried to kill him, and everything will be written in a language uh, with reduced medical jargon uh, to match his description. So then we have to write about his injuries. So nature of the injuries, size, shape, disposition, and the size of the injury should be marked. So we have to number the injuries first, because these numbering will help in the next few parts of the medical legal report. So these are the injury patterns, and so like we have to write 1 to 1 centimeter abrasion on the right side of the nose, 0.5 centimeters away from the tip of the nose. So in that we explain the nature of the size of the injury, shape of the injury, disposition, and the size of the injury. So then we have the category of the hurt part. So in D part, first we have to write the non-grievous injury. Uh, Non-grievous injury are the most harmless injuries compared to the other injuries. Grievous injuries, I will be giving some idea in the end of the presentation. So so. So we have to write the non-grievous injuries first. Then there is a somewhat explanation on grievous injuries. So in this patient, this example, this patient has a deep cut in the posterior left forearm and deep cut injury in the left palm. So those injuries are the uh, categorized in penal code, which is දණ්ඩනීති සංග්‍රහයේ 311 වගන්තිය යටතේ these people have to the assailants should be punished with these records, because the grievous hurt can the non-grievous or the grievous hurt can differentiate the punishment of the assailant, the number of the prison sentence or any punishment can be vary. So grievous hurt is the more damage to the victim and more prison years for the assailant. So, so grievous injuries should be written like this, and also then there is a part that explains the injuries which is happen from a blunt injury or a sharp injury. So sharp injuries means mostly a pointy or any very sharp like cut injury or stab injury type of injuries. Blunt injuries are different, like lacerations and the things, contusions, lacerations, and the those injuries. These we'll discuss them in later in next sessions. So then there is a part just before the fifth part. There is the part in the Vadiduru Satahan. The further notice we have to write the whether the injuries is compatible with the given history. That is important because the like if the patient's injuries do not match with the description, there can be a lie. So the patient may use false things, false confessions. So that can be assessed in the courts because the uh, lawyers can lawyers can make some assumptions and make your life harder in the law if there are some discrepancy between patient's history and the injuries. So you have to write that as well. So then whether the patient is under liquor, any liquor or any alcohol, we have to write that. Then so other things, designation, station, and the date of the report. And finally, you have to put your signature. And there are some instructions like the doctor has to fill this and put the signature, and he have to uh, kept a copy with him uh, in his career, future career, because he can be summoned at any time to the courts if there is any major case. And also, doctors have to use a good language and good write in a good handwriting, and as well as you have to minimize the medical jargon as well. And also so you have to register, post these documents to the courts if the documents are summoned. And also when he's getting transferred, the doctor has to keep it safe. And what are then we have to learn bit about the 311 sentence of the penal code. So so the type of these are described in the grievous injuries, and in grievous injuries in section A explain emasculation. It is self-explanatory, and it's removing the man's manhood. So it is the first one in the grievous injury. B is permanent privation or impairment of one eye or both eyes, and C is the same as the B. Difference is it is the privation or impairment of the hearing in a ear or both ears. And the D part explains privation of any member of joint. That means weakening or the stopping the work of the any organ you like. And in E part and F part, it is basically describing disfiguring. E part, it is describing destruction or permanent impairment of uh, any member of a joint. So like fractures and other things are categorized in this part. And then F, permanent disfiguration of head or face. That means if there is any scarring, that also that also will be taken as a grievous injury if there is permanent disfiguration. If there is any slight injury to the face, it will be categorized in grievous injury, and the uh, the assailant will be punished accordingly. So then G, there is a cut or fracture of the bone or cartilage or tooth or dislocation of subluxation of bones. And in H, there is any injury which endangers the person's life and the whether involves with the surgery in thorax, abdomen or cranial cavity. So that is the H. In I, whether there are any injuries which cause the sufferer to be severely bodily pain, which causing impairment of his activity of daily living for more than 20 days, that also taken as grievous. So these are the nine kind of grievous hurts. So this kind of injuries get more punishment than non-grievous injuries. Uh, so if there are any questions, you can put those in chat box. And so if there are no questions, we can go to the MCQs. Okay, so we can go to the MCQs. So in MCQ 1, it is regarding the inquest procedure. So first answer A, as magistrate should do the inquest of a death of a person in a mental hospital. It's absolutely correct because the death in custody, death in prison, and death in mental hospital is is a uh, is a power beyond inquiry into sudden death because uh, these patients or the persons are kept against their will. So only magistrate can do the inquest. So answer B, should get consent from the next of kin to do the autopsy. It's actually wrong because in inquest procedure, autopsy is not going to be done. But if it's asked like in a after inquest procedure, if the cause of death is unknown, then there is no need of consent to do the autopsy because it is a judiciary uh, postmortem. And then C, inquirer can request any of the medical reports of the disease. It's correct because to come to an apparent cause of death, it is very important to know the medical background of the patient. And it is open to public. It also a correct statement. And the main aim to find the apparent cause of death, it is correct. And the second question, an inquest, private inquiry into unnatural death of a patient, it's wrong because inquest is a public inquiry. All deaths, rabies deaths, it's right, it's correct answer. So then conducted by the JMO. In Sri Lankan setting, inquest is done by the inquiry into sudden death or the magistrate, not by the JMO. In the all prison deaths, they need the inquest by the magistrate. It's also true. Person died from a train accident need the inquest. It's also true. And then MLEF, uh, MLEF issued to court after receiving summons. It's correct. It's usually no, it's incorrect because MLEF is not the document which is used in the courts. So it's MLR, medical legal report. So first one is false. Then consent is not needed. It's wrong actually because MLEF to fill the MLEF we need to get the patient's consent. Like after admitting to the um, hospital, they have to go with the MLEF. So If they do not give the consent, we can't do. And sexual assault recorded as a grievous hurt, it is wrong because sexual assaults are categorized in other parts of the penal code other than the uh, 311 sentence. So it's wrong and not filed in the not it's not filed not filled in the rape cases. MLEF it's wrong actually. In rape cases also MLEF is will be filled and not needed in hospital admission of a patient due to assault. No, it's not needed because MLEF is filled after hospital admission. So no need of no need of uh, taking the no need of MLEF before hospital admission. It's wrong. So then medical legal report. It is a document sent by the doctor to the court containing details about history, examination findings, and opinions of the victim of the injury. It is correct. Then alone is sufficient as medical evidence in the case of rape means it's wrong actually because sometimes in this case they ask alone is sufficient as medical evidence in a case of rape. So it's not always true because in a rape case doctors will be summoned and they'll be asked questions. So alone in medicine most of the times uh, absolute things are not there. So alone is not sufficient usually. In this case, it's not sufficient in a rape case. So contains information not available in the medical legal examination forms. Uh, contain information not available in the medical legal examination form. Yes, it's true because medical legal report is more extensively describing the pattern of the injuries, category of the hurt, and the other injuries as other things as well. So, medical legal report is the um, so in D, they ask about the has a doctor's copy and the police copy. Doctor's copy and police copy is needed in the MLEF. In MLEF, there are two copies, like doctor's copy and the police copy, and there are small clarification. Like one thing is in both doctor's copy and police copy, A part is filled by the A part is filled by the police officer, and B part is filled by the doctor. Um Then next one is MLR has more value in court procedures than MLEF. Yes, it's correct because MLR is a document which is summoned to the courts. Uh, it's correct actually. So these are the MCQs. These are very basic MCQs because this is our introductory session. Uh, So this is the lesson actually. So we covered death investigation system. We talk about the what is the reason behind doing a death investigation system, and then what are the two systems functioning in the world, and what is the inquest procedure, and postmortem types of postmortems, and the death registration system in the Sri Lanka. And also we talk about the MLEF and MLR and briefly touch about category of hurt, basically grievous hurt we covered. So grievous hurt will be covered in next few sessions as well. Uh, so for now, that's it. Are there any questions? Uh, you are freely, you can put any question in the chat box. Since there is no questions, I would like to end the session. So you all can join in our next sessions, which will be covered in next few months. And as I said before, whole forensic syllabus will be covered in 18 weeks of sessions. And hope to meet you all soon. And good night. Bye.